Yeah, one of the things public health labs always do is keep an eye on what's going on around the world. So when we heard about some of these cases in China, we were, of course, keeping an eye on that and made sure that we were thinking of approaches that we could use in the lab should it emerge in Canada. But it became more real, I think, in February, mid-February, when we were seeing the global numbers, the situation in China and the global numbers start to increase. So it's a molecular approach, which means we're actually detecting the virus genome or nucleic acid, and you can do that in a number of ways, but essentially you're targeting the specific virus. So when the virus sequence was shared in the diagnostic and public health and scientific community globally, we were able to quickly adjust our current tests, which we had a test to detect other coronaviruses. We were able to quickly adjust that so that we could specifically detect the COVID virus. Well, when you're trying to look and monitor the emergence of a particular disease, you have to be able to definitively say this person was infected with this particular pathogen. So you need a specific test that can definitively say this person was infected with the virus or not. Absolutely, and it's particularly important in this because of the range of symptoms from asymptomatic to fairly severe illness with symptoms that is common for this time of year, in particular with influenza-like illness and the common cold. So what happens is through various sites, for example, on hospital wards or in the emergency departments or in these assessment centers that have been set up, nasopharyngeal swabs are collected on the patients, and they're put into a liquid or media, and then they're transported to the lab. The results our instruments are connected to the lab information system, and the data flows out to our public health partners for contact tracing or to health links for calling out the negative results. We're aiming for about 24 hours. A sample comes in, and within 24 hours we can get the results out, is what we're aiming for. It's in APL, Alberta Precision Labs, and it's the Public Health Laboratory is where the testing has so far been based. And we have a site in Edmonton and we have a site in Calgary. For the past number of weeks, we've essentially been running from about 6 in the morning till 2 in the morning. So 20-hour day to try and keep up with the volume of samples coming in. Yesterday, the number was above 4,000 in one day. So we're continually building up our capacity. And so we will continue to go up from 4,000 to more than that as we get more capacity in other labs. We get more extractors and PCR machines in our current labs, and we're able to decentralize the testing. So we're going to be able to build up significantly. The biggest challenge in all of this has been the supply chain. It's a massive global demand for reagents for the lab, and so that's been a rate limiting factor. So we're working with our procurement teams to source reagents from multiple different suppliers, but it is a huge challenge. The goal is to do as much testing as we are absolutely able to do, and that's what my focus has been. But I know we're doing quite well relative to other provinces and other countries, actually. Healthcare workers are definitely a priority for testing right now. Hospitalized patients, emerge patients are definitely important for testing right now. Long-term care facilities absolutely are very, very important, vulnerable population to make sure that we've got adequate testing. When you have say a homegrown a company like Spartan, which is based in Ottawa, that's able to ramp up production and produce these instruments and produce the kits. That's why the decision was made to go with Spartan as one of the components of our response to building more capacity and improving access to testing in a more decentralized manner. You can imagine if a swab is collected in a remote site, say in northern Alberta, there's a transport time element to that, right? And so that may add on a day or several days to the test turnaround time. So if you can get the testing more close to where the samples are taken, that's going to improve your turnaround time for those local tests and provide more local capacity for the testing that's required. The expectation and how we're going to roll this out, it would be same day. Within the second week of April, we should start receiving the instruments and being able to assess the product and validate it. And then by the third and fourth week of April, we should be in a position to start deploying the devices to strategic locations. Self-isolate if you've got symptoms, self-isolate, social distancing, hand washing, that is the absolute main thing that can be done. And also for individuals to appreciate that it's impossible to test everybody, and we have to target the testing on those that are most at need, the more severe illness, the vulnerable populations, the hospitalized patients, etc. So there is a process that's, what you call HealthLink. There's the assessment tools that are online. And the way to figure out, do I need to be tested or not, is to simply go online, either talk to HealthLink or you do those online tools, and that will guide you with the current algorithm for who needs to be tested or not.
Together, we do amazing things every day.